Hello everybody, Dr. Garrett Weegriff here at Pure Plastic Surgery. We are talking about breast surgery today, and specifically we are talking about new techniques and technologies that we are using for breast surgery. So first of all, let's start with some of the technology that we have that is on the newer side. So first of all, we're going to start with one of the most common tools that we are using, which is our breast implants. Now, breast implants have evolved a lot since they were originally invented, and we've gone back and forth between saline and silicone. And we're now on basically our 5th generation of silicone implants. And what exactly does that mean? It means there's been a lot of research and development that have gone into these implants, and they're a much more superior product than they were even 20 years ago. And so that's really the exciting thing about placing implants nowadays is there's a lot of new technology that goes into the implants to make them last longer, look more natural, feel more natural, maintain their shape, decrease rates of capsular contracture, and that's all thanks to our partners in industry like Allergan, who we get our implants from. Implants used to have silicone gel in them that if you would cut it open, it was this gooey mess that would leak out of it. We're now using a highly cohesive silicone gel that if I cut an implant in half, it's just going to stay like 2 halves, like cutting a gummy bear in half. That's where we get the term gummy bear implants. They're also going to last a lot longer. Most companies still, their warranties are for 10 years, but I suspect the most recent implants that I'm putting in are going to last much beyond 10 years. So it's something that we're going to have to it's something that we'll see in the future how that really plays out, but I don't think it's going to...
Yes, I'm doing it.
Willie's back here cutting open an implant, or getting me a knife so I can cut open an implant.
Yes, Doc, of course.
So that really is, people think an implant is an implant, but that's not really the case. So.
Okay, I'm going closer, Doc, with a zoom so everybody can see the gummy.
All right, so I am not using a proper technique here, but we have a blade and I'm going to cut into this, and then I might even need to cut this on the table a little bit. But we're cutting all the way around the capsule, and if you see, I've cut the outer capsule, and now this is that cohesive gel that's all stays put where we basically left it. So if your implant actually ruptures, it's going to stay where we left it. So we could cut this the rest of the way in half, and it would just continue to look like that silicone gel within the capsule. What is the other technology that we are using more frequently now? And we are using a lot of techniques and technologies actually from what we've learned with reconstructive breast surgery. So one of the things we used a lot with reconstructive breast surgeries was different type of mesh, or something called acellular dermal matrix. And it was great for supporting implants or creating a pocket and holding that position, being able to divide things better, but it was prohibitively expensive to use in cosmetic surgery. There's now a new device or a new mesh that is a mesh that will actually be absorbed by your body over time, but in its place it's going to leave a very strong scar tissue that leads to extra support there, and that's called a Galaflex mesh. And so this is allowing us to use some of the techniques we use with reconstructive surgery in a cosmetic setting, because we can do this for a more affordable price now. So Galaflex mesh, or the internal bra, is the other big piece of technology that we're able to utilize more in aesthetic breast surgery, and that can be done in combination with placing implants, doing a breast lift. So it's a great tool for us to have in our toolbox. The third thing that we've also stolen a little bit more from reconstructive surgery that we're utilizing more often is fat grafting. So fat grafting can be a tool in and of itself to restore volume to the breast, or it can be combined when we're doing certain patients that have thin tissue. They already have their implants in a pocket that they like, but you can see some rippling, or you can just see the definition of the implant. We can go in there and we can use fat grafting to fill out those areas, and it's just another tool that we can use to optimize your results. So we use this hybrid approach where we utilize many different things, our implants, our mesh, fat grafting, to get you the best possible result. So I would say those are the kind of, and, fat grafting itself is not a new or novel thing, but it's being used more and more in a hybrid approach to getting the best results for your breast surgery. And I would say that's a more recent trend. So we covered a few things. I would like to hear if anybody has any questions.
Okay, we have one regarding the Galaflex, and if it could be added to a breast lift instead of breast lift with implants.
It can be. Some surgeons do that. I don't really see the great benefit of that unless it was maybe a massive weight loss patient who we've tried to do a lift on in the past, and you just really started to droop pretty quickly after surgery. It's something we could consider and talk about, but I don't know if the cost is going to be worth it for a primary breast lift and you have pretty good skin quality. If you have poor skin quality, you want to do it with a lift, it is something that we can do and something we can talk about.
Okay. Is it better than the saline? I guess they're talking about the gummy.
So
Is it better than the saline implants?
So in my opinion, yes it is, for a few reasons. One, it looks more natural, it feels more natural, and like I said, they're probably going to last longer than saline implants are. I can't say that for sure, but that's the trend in which it's going right now. So I like silicone implants much more than saline implants. Saline implants really start to look like a water balloon, basically. In there you can see more rippling. There's less rippling with a cohesive gel implant. So I think silicone's a superior product, and you always need to keep in mind what is touching your body is a silicone shell for either of those implants. So for a saline implant, it's a silicone gel that's filled with salt water. For a silicone implant, it's a silicone gel that's filled with silicone gel.
What's the healing time for drainless tummy tuck on TikTok?
The healing time is basically 2 weeks of quite a bit of downtime. You're gonna want to avoid working for 2 weeks, but after that, if you work at a desk job, you can probably go back to your desk job at 2 weeks. And then it's 8 weeks of no vigorous exercise or heavy lifting. And after 8 weeks, you can go back to most of your normal activities.
Okay. And they're also asked for the massages after tummy tucks.
I recommend getting the lymphatic massages after tummy tucks, especially for the drainless technique, because you are going to accumulate a little bit of fluid, and those massages help dissipate that fluid. It gets it to areas where your body can absorb it.
And the same person asks, so why drains?
Why drains? For a few reasons. One of them is just the time under anesthesia for me to do a drainless technique. It requires more layers of suture, more time in the operating room, and a little bit more cost. And so it's an option for you if those things bother you, but drainless is a great option for a lot of my patients.
Okay. Could we have Exparel for breast procedures?
You could have Exparel for breast procedures. Especially if you think pain is really going to be an issue for you. Breast procedures such as breast reductions or breast lift without putting an implant underneath the muscle are very well tolerated, and I don't know if it would be worth the extra cost of Exparel. But when we're doing it, placing implants underneath the muscle, that does give a feeling of tightness that the Exparel would help with. I also give all of my patients muscle relaxers. That helps quite a bit with that discomfort as well.
Here on TikTok, they ask, where are we located, Doc?
We're located in Miami, Florida. Please contact us at pureplasticsurgery.com, and we'll be happy to do a consultation with you and get you down to Miami.
Okay. Yes, going back. We're fine. We are ready.
All right, everybody, have a great day, and I will see you next week for another episode of Thursday Thoughts.
Okay. Bye-bye.